This is an Eastern Pennsylvania Continuum of Care coordinated entry training for specialists working in our call center and our access sites. This is a training on our opening conversation. The purpose of this conversation is to determine whether or not someone presenting as experiencing a housing crisis or homelessness is eligible for our CoC services and should receive a core entry intake in PAHMIS. This opening conversation can be downloaded from the PAHMIS training materials in PAHMIS client track through our train or production environment. And in the home section of your PAHMIS login, there is a PAHMIS training folder that contains this in the reading materials. It is also available upon request from a core entry regional manager or the core entry consultant. This guide begins with an introduction to just talking to someone who's either calling 211 for our call center specialists or walking into or connecting with a CE specialist in one of our access sites and essentially tries to identify upfront whether this is a housing or homeless crisis. And unfortunately, because of federal laws and policies, not everyone who identifies as homeless by community definitions or school district definitions is eligible for enrollment into core entry and access to our housing and emergency services that are HUD funded. So it's critical that this opening conversation be a way to figure out whether or not a household is eligible for enrollment into core entry. If they are not, they can be connected to other local resources, and perhaps it is best to recommend they speak with a 211 navigator for other health and human service referrals. But what we're trying to accomplish first is just make sure we know who we're talking to, what their living situation is, and whether they are in any imminent danger. And so the 8 questions here are what we would like specialists to talk through before opening or updating a client record in PAHMIS. So question 1, may I have the spelling of your first and last name? And the best way to get a hold of you is just a way to record some basic information, particularly if you're on the phone with someone and they can't stay on the phone or you lose the connection. We know we've begun talking to. What county and zip code are you currently living in helps us understand whether they are currently an Eastern Pennsylvania CoC resident in one of the 33 counties in our CoC. There is a core entry system in every community throughout Pennsylvania and the nation. And if they are contacting us from a county outside of the Eastern PA CoC region, they may be better served by being connected to core entry in that other community. If the client is not residing in the Eastern CoC, then they must be HUD Category 1 or Category 4 eligible for an intake and continue. Then you would continue screening to determine that specific eligibility. What we are referring to is the fact that if a household does not meet the HUD criteria of Category 1 literal homelessness or Category 4 fleeing domestic violence or other forms of violence, they will not be eligible for housing services and a full enrollment that includes a housing assessment and placement on the by name list in HMIS. They may be a Category 2 household, and that HUD definition is primarily for households that are 14 days or less away from being homeless and do not have the resources or a place to live on their own. These HUD definitions are defined in other core entry trainings. Those training videos and slide decks are accessible again through PAHMIS in our PAHMIS training folder, as well as on our YouTube channel and in the core entry section of the Eastern PA CoC website. It's important that specialists are very familiar with those definitions because if a household does not meet the Category 1, 2, or 4 definition, they cannot be enrolled in our system. Then the third question is a safety planning question. Is your current housing need due to you or another household member leaving or trying to leave your home because of domestic violence, sexual assault, stalking, or human trafficking? If the answer is yes, the person is eligible for a transfer to a DV or trafficking hotline. Ideally, you would make a warm transfer. Information on those services is, if you're not familiar with those service lines or contact numbers, that information is in our Eastern Pennsylvania written standards, as well as our Eastern Pennsylvania CoC court entry policies and procedures. Or you can ask a court entry regional manager for that information. If the person would like a referral, make a warm transfer or give them the hotline telephone number and end the conversation without creating or entering any information in PAHMIS client track. It's possible they are fleeing and are still seeking CoC services, in which case you would move forward with this conversation. And also, if they do identify as actively fleeing, note that because later in a PHMIS Cat 1 intake, you will be asked to record that information, but we don't want you to ask that question again since it is traumatizing. If you already know the answer, you can simply record the answer from these initial notes. Question four, have you or any other household member served in the United States military, including the Army, Navy, Air Force, Marine Corps, Coast Guard, Reserves, or National Guard? It's important you ask this question this way because this provides eligibility for additional veteran services. Not simply all of CoC services, but all CoC services and special veteran services like the SSVF program. If they answer yes to this question, then you will be answering yes to the veteran question when you're creating the core entry intake in PAHMIS. And in addition to any other emergency service referrals, you will make a referral to at least one SSVF provider serving that community. Question five is only for 211 specialists and relates to the 211 data system. Access site specialists would move to question six. May I please ask where you slept last night? It is important to understand that the Category 1 definition of homelessness is about where a person or family slept the previous evening, not where they think they are going to sleep this evening. So if the person slept outside on the street, in a shelter, in another place not meant for human habitation, then they would meet that Category 1 definition and you can move to the full court entry homeless intake in PAHMIS for Cat 1 for households. If they did not answer in a way that makes them eligible for Category 1 or actively fleeing, making them eligible for that same project, but as Category 4, then you're going to want to continue with this conversation and ask, are you going to lose your housing in 14 days or less? Or if they've said yes to the veteran household question, 30 days or less. And what you do is the beginning of identifying whether they're Category 2 eligible. But no matter what you want to do is attempt housing problem solving or diversion, and if possible, help them think of ways to stay where they are housed if it's safe, for example, with friends or family, and that may involve special skills that we offer training on around motivational interviewing and strengths-based planning and conversation. So what we're trying to do with a housing problem-solving attempt is to avoid anyone spending another night on the street or avoiding having to go into an emergency shelter if they have other temporary housing solutions. If the attempt is not successful, then the last question is, do you want a referral to a homeless prevention program? If yes, and they meet the Category 2 criteria, you would then go into PAHMIS and conduct a CEHP intake East for Category 2 only and make a referral to a homeless prevention project. Additional trainings are available to guide core entry specialists through the Cat 1-4 intake process, the Cat 2 intake process, adding court entry intake notes in PAHMIS, fielding our triage assessment, and fielding our housing assessment tool. Those trainings are available through the PAHMIS training folders in PAHMIS, through our YouTube channel, and links from the Eastern PA CoC website.